Hello folks, Jon Fuller here. Thank you so much for taking a moment to watch this video on the plan changes for Medicare in 2026. There's definitely some important information here. So thank you for taking the time. Here is the agenda for our video today. Why are you getting this? Number one, and then we're going to take a look at some reminders for the annual enrollment period and the open enrollment period. Whoops. And then who is Jon Fuller, and then some of the important changes for Medicare in 2026, then a quick Medicare education refresher, and then we'll wrap up. It shouldn't take too long. There's only two reasons why you are watching this video. Number one, you are my client, and as my client, I made this video for you to provide information about 2026 changes and remind you that I am here to help you if you have any questions or would like any assistance. And two, if my client sent this to you, then thank you for taking the time to watch this video. I hope that you find it helpful, and you're welcome to reach out to me, and I'd be happy to help you. All right, important reminders about the annual enrollment period every year. The annual enrollment period starts October 15th and goes through December 7th every year. The AEP, that's what we call it for short, is specifically for people who want to make a change to their Medicare Advantage plan or their prescription drug plan, or they have a Medigap, which is also known as a Medicare Supplement plan, or Original Medicare, and they want to enroll in a Medicare Advantage plan or prescription drug plan. It sounds a little complicated maybe, but the bottom line is this is the time of year for anybody to make any kind of a change. That's the bottom line, okay? You should receive your ANOC, or also called the Annual Notice of Change, by the end of September. This is the document that your current Medicare plan must provide each year. The ANOC describes any changes to your current plan for the following year. It is very important that you review your ANOC every year. As your agent, I'm happy to review your ANOC with you. Just let me know. And also really important, you do not have to make any changes. This is always can be some people might not be aware of that, but you do not have to make any changes. You can stay on the plan that you have. Important reminders about the open enrollment period. I'd just like to give you a quick reminder about this because a lot of people are unaware that we even have this. The open enrollment period starts January 1st every year and goes through March 31st. That period of time is specifically for people who are on Medicare Advantage plans and want to make a change to their Medicare Advantage plan. They can switch from plan to plan. During the open enrollment period, people who have Medicare Advantage plans may change to another Medicare Advantage plan. And these people may also choose to drop their Medicare Advantage plan and go back to Original Medicare and enroll in a standalone prescription drug plan and or a Medicare Supplement policy if they choose. You do not have to make any changes. You can stay on the plan that you have even during the open enrollment period. Other important reminders about AEP and OEP. Like every year, you will likely receive many phone calls, mail to your home, emails, and possibly even text messages from people wanting to entice you into contacting them or offering something that looks better than what you have. These are all attempts to switch your plan. This is how insurance carriers and agents get paid. So beware of advertisers of all kinds. Tell them to take you off of their list and call me if you have any questions or concerns. That's what I'm here for. Please do not make any plan changes without me. If you do, you will fire me as your agent. I do work for you. It's my job to help you with these plan changes, and I will always work hard at protecting you and your family with the plans that work well for you in your particular situation. Who am I? My name is Jon Fuller. You should recognize me. I am your independent Medicare insurance agent and probably have been for many years now. I've been helping people for 14 years, believe it or not, and I help people with Medicare supplement plans, standalone prescription drug plans, Medicare Advantage plans, ancillary products like dental and vision, life insurance, and long and short-term care plans, also annuities and other types of products too. I also help people with health insurance for individuals and families, and my assistance is always at no cost, no obligation, and no pressure. I'm a very easygoing guy. I'm not here to push you or sell you anything. I just like to help people. And for some reason, my cell phone number did not pop up there. It's not on the slide. It is 801-448-4800. You can find that on my website, which is rockymthealth.com. Okay? Oh, look at that. There it is. It populated. Okay, there's my phone number. All right, let's take a look at these big plan changes, or changes to Medicare, in 2026. This is really important, folks. As of January 1st, 2026, some employer plans will be considered not credible to Medicare. That's really important. If you currently are being covered by your employer, I really suggest you give me a call. All right, that's really important to understand the potential penalties for not enrolling in Medicare if you're on an employer plan and you're eligible for Medicare. So make sure you pay attention to that. In 2026, the maximum out of pocket for prescription drugs is going to be $2,100, which is $100 higher than it was in 2025. So that'll be the max out of pocket on prescriptions for 2026. Other things to keep in mind are possible changes in your Medicare Advantage coverage. Make sure to check your ANOC. Some carriers are leaving markets and dropping plans. If you are affected by one of those carriers, you will receive a letter. So make sure to look out for those types of letters in your mail. Some other big news: rates for Medicare supplement plans have been on the rise, even 30 or 40% on average. Some of these are much higher. So please pay attention to your rates if you have a Medicare supplement plan. If that's a concern, you need to reach out to me. Rates for prescription drug plans have been on the rise a lot. Okay, if you didn't notice that, I'll just say that they went up a lot as of last year, and they look to be continuing to rise based on this maximum out of pocket on prescription drugs and how that has affected plans. Excuse me. All right. Another one. Healthcare is changing, and providers are being incentivized to have a deeper relationship with their patients. So that means you can expect to be contacted by carriers more frequently, asking you more health questions and learning more about your current state of health in order to help keep you healthy and prevent future risks. Part B is going to be going to $206.50 per month in 2026. Just to give you an idea, it's $185 right now. So that is a $20 or $30 increase. That's $20, $21 increase from 2025. Talking about other changes in 2026 and your prescriptions. In 2026, the deductible will be $615. That's an increase of $25 from $590 in 2025. Copay or co-insurance after the deductible phase, depending on the plan you have, you may pay a copay, or co-insurance now is becoming more common for prescription coverage during the initial coverage phase. And then catastrophic is once you reach that $2,100, you won't pay anything else for medications in 2026. Technology is always changing in this industry. As I mentioned last year, I have a website specifically for you, for my clients, for enrolling and for finding out which plans work best. This is what my website looks like for Medicare. And an important part of this is going to be becoming more and more important as we move along here is going to be keeping you, my clients' information up to date each year and helping to make it easier for us to find plans that are going to work for you each year in accompaniment with whatever plan changes are happening. So I'm going to be making another video actually specifically about how to use this tool to help give some guidance. So look out for that video in this email. But once you create an account here on my Plan Enroll website, you're going to have access to a lot of really great information, including your current policy information. You can put that in here, and your Medicare information, as well as your doctors and clinics and prescriptions and pharmacy information. You can all keep this in here. This is connected with me. We would share this information, and it would also give you access to this system where you can shop your own plans on your own time, at your own convenience, and everything is in one place. Okay, it keeps track of everything. This actually works for health insurance and life insurance as well. If you ever wanted to shop for yourself for life insurance without even talking to me or anybody else, you can look at all sorts of different companies, and it would have all of your information and be able to give you an accurate quote based on your medications and medical history, etc. So some really cool stuff, as well as educational material, and of course access to me and my information and everything once you create your portal. Also, this is just a look at what it looks like when you compare plans, when you have your own portal in there. You can compare the costs of drugs, whether or not a doctor will be in a network for a given plan, the total estimated drug cost, the premiums, and all of the benefits side by side. So it's a really useful tool. And so look out for that. This is the actual URL. Don't worry about that. This will be in the email, as well as the video on how to do that. Now, we're just going to go into a quick refresher on Medicare, and this is just to remind you about how Medicare works very quickly. Original Medicare, Part A and Part B. On Part A, usually there's no cost as long as you've spent 10 years working and paid taxes, and Part A will help pay for hospital, skilled nursing, home health care, and hospice care if you only use Original Medicare. Part B, the premium for Part B is going to go to $206.50 per month in 2026. And Part B helps with doctors, specialists, ER or urgent care, radiology, and ambulance. Remember that Original Medicare does not cover drugs. So in order to cover prescriptions and to help with the costs not covered by Medicare, you're going to choose one of these two pathways. Medigap, or what otherwise called a Medicare supplement policy, along with a standalone prescription drug plan. Or pathway number 2, otherwise called Part C, which is a Medicare Advantage plan. Those do have tend to have different types of Advantage plans like HMOs, PPOs, PFFSs, and those usually will cover prescription drugs in them. Okay. Medicare supplement plans offered A through N, depending on the carrier. Here in Utah, if you received Medicare before 2020, you can still buy a Plan C or a Plan F over there on the right-hand side. If you became eligible for Medicare after 2020, then you can no longer purchase those. And you'll see here that the increase in the Part A deductible for 2025 went to $1,676, and the Part B deductible went from $240 to $257 in 2025. Is what that is. Sorry, I was 2025. 1676 is in 2025. These are the numbers for this year. The out-of-pocket maximums went up a little bit for K and L. If you have further questions about Medigap or Medicare supplement policies and how they work or how they might benefit you, please reach out to me. Medicare Advantage prescription drug plans. So here's the main changes in 2026 are the Part B premium, which still has to be paid when you have a Medicare Advantage plan, and then the prescription drug, which is capped at $2,100 in 2026. Other than that, this is just a quick layout of how Medicare Advantage plans work. You must be enrolled in Original Medicare Parts A and B in order to get a Medicare Advantage plan. You want to pay attention to what type of plan you have, whether it's just a standalone Medicare Advantage without prescription drug coverage, or a MAPD, which is prescription drug coverage. That's a Medicare Advantage prescription drug coverage plan, or a dual SNP. That's what the D stands for. That's a dual eligible, means you have Medicare and Medicaid special needs plan. And then a C SNP is for people who have chronic illnesses like diabetes, and there's special needs plans available for people like that. And then the I-SNP is for people who are in an institution. There's institutionalized plans for special needs plans for people who are in institutions. You want to pay attention to either your providers are covered or your prescriptions are on the formulary. You want to make sure that you do that every year. Plan costs, you want to pay attention to your maximum out of pockets and what changes may have happened for your copays. For the following year. Let's see. And then you do want to just know a couple of important things about here, that you should have worldwide emergency medical coverage on these plans. And you can only be on one at a time. And let's see, one card for medical and prescription coverage, and usually covers preventative services at little or no cost. So just pay attention to your ANOC if you've got one of these. Why choose Jon Fuller? Why work with me? I make Medicare easy. I always help you to understand how Medicare works and answer any questions. I do the work for you. I can help you find a plan that works for you and your particular situation. I am an independent broker. I'm not captive. I am able to offer you all of the plans available in the area typically. I have been a professionally licensed insurance agent for almost 14 years. I do know what I'm doing. And here's the most important one if you ask me, folks. I am your advocate. I enjoy working for you, and I enjoy it when my clients call me during the year with questions and concerns and problems. That's where I actually get to do my job, and I enjoy it. So make sure you make use of that. I'll tell you right now, there's a lot of agents out there that don't do that. They don't do the service work, okay? I've had plenty of people call me just this year looking for a new agent because of that reason. So just remember, I enjoy working for you, and that's important. So reach out to me and make sure that you let me know how I can help you. All of my professional support and advice is always at no cost, no pressure, no obligation. I'm an easygoing person, easy to work with. So make use of me, please. From my family to yours, thank you for being my client. Thank you for your ongoing trust. It is because of your continued loyalty that I am able to raise my children and provide for my family. I appreciate you so much. Please remember to contact me at any time for any reason. I'm always available. And as I always say, keep my number in your cell phone and just reach out to me without any hesitation. Thank you again for taking the time to watch this short video. I hope that it was helpful. And I hope to hear from you this year. And if I don't, have a really good season and holiday season. And we'll talk to you later. Thank you.